Fibrinolysis for pulmonary embolism patients. Pulmonary embolism is when one or more pulmonary arteries in your lung become blocked. In most cases, pulmonary embolism is caused by blood clots that travel to the lungs from the legs or rarely other parts of the body, also called as deep vein thrombosis or DVT. Symptoms. Common signs and symptoms are shortness of breath, chest pain like a heart attack, coughing that produces blood.
If you are immobile for an extended period of time because of surgery, pregnancy, illness, or travel, you may be at risk for deep vein thrombosis, or DVT, a condition where a blood clot forms in a deep vein in the body, typically the leg. Unlike arteries, which rely on the heart to force blood through them, veins transport blood with the help of muscle contractions while you move and walk. Veins also have valves that keep blood from flowing backward and pooling in your arms and legs. When you are immobile for an extended period, your venous circulation slows down. As a result, clotting factors in the blood may cause the slow-moving blood to clump together, forming a blood clot or thrombus. This condition is called deep vein thrombosis, or DVT. Common symptoms of DVT include swelling of the leg or a vein in the leg, pain or tenderness in the area, increased warmth in the skin, and red or discolored skin. In some DVT cases, a blood clot may detach from a deep vein and join the bloodstream. The clot travels from the deep veins of the leg, through the veins of the abdomen, into the heart, and finally lodges in the pulmonary artery or its branches, blocking blood flow to the lungs. This condition, called pulmonary embolism, is very serious and may permanently damage a portion of the lung. If a clot is large, or if there are many clots, pulmonary embolism may also cause death. If you experience symptoms of PE, please tell your doctor or nurse immediately. These symptoms may include shortness of breath, a sudden sharp pain in the chest, a feeling of lightheadedness or dizziness, rapid or irregular heartbeat, or coughing that produces blood. To help prevent deep vein thrombosis and pulmonary embolism, your doctor may require you to do the following. Walk around periodically to keep the blood from pooling in your legs. Wear compression stockings, and take anti-clotting medication.
As the video shows us, DVT or deep vein thrombosis can cause pulmonary embolism. Here's an animation about how this can be caused. A clot is formed in a vein and is released through circulation, and it's going to travel all the way up to the heart, pulmonary veins, and at the end to the lungs, causing pulmonary embolism. Treatments. Prompt treatment of pulmonary embolism is essential to prevent serious complications and death. Medications. Blood thinners, anticoagulants. These drugs prevent new clots from forming. Surgical and other procedures, like clot removal. If you have a very large clot in your lung, your doctor may suggest removing it via a thin, flexible tube catheter threaded through your blood vessels. Fibrinolysis for intermediate risk of pulmonary embolism patients. For anyone with pulmonary embolisms, PE patients, your early diagnosis and treatment can save a life. In patients with high risk of pulmonary embolisms and signs, of hemodynamic compromise, fibrinolysis is an established clear choice that can reduce pulmonary artery resistance to prevent pulmonary embolism recurrence and reduce mortality. Many studies have suggested that fibrinolysis in patients with intermediate risk of pulmonary embolism, fibrinolytic therapy had hemodynamic decompensation but increases the risk of major hemorrhage and stroke. Here's a video of
than people think is to have a blood clot that comes from the legs usually and travels through the blood system up in through the heart and into the lungs. Now, normally when blood goes to the lungs, we capture oxygen there. If a clot comes up to the lungs, then it blocks blood flow, and so we don't have good oxygen to the lungs after that blood clot. And so it's a huge problem that people have. Now, usually it's people that have swelling of the lower extremities. So it's somebody after knee surgery, somebody that's in heart failure, somebody that's in a protracted hospital bed stay where they're on their back in bed for a long period of time with an illness. Those people are prime candidates. Some people have blood clotting disorders. Some people, when they're in a trauma, car wreck, actually, and don't hurt the knees, actually you can get fat that comes from bones that can get into the bloodstream. That's another cause of emboli. Since we're blocking the blood supply to the lungs, or part of the lungs, the symptoms are usually shortness of breath. You have pallor, you feel anxious, there's chest discomfort and pain. Usually you lean forward in order to get some relief. You know something's wrong that's going on, and you feel very uncomfortable. Sometimes there's a feeling of impending doom, like, I think I'm going to die. If those are symptoms you have, then you need to be sure that you call 911 and you get the ambulance there, because there is good treatment. So the symptoms are chest pain, sometimes we cough up blood, very fast heart rate, diaphoresis, sweating, and I know I'm sick. The treatment is, number one, if it's a severe one, there are clot busters. Same thing when we have strokes and when we have heart attacks. There's medicine that will help dissolve that clot before we get too much damage to the lungs. But let's look at chronic pulmonary emboli. Those are little bitty clots that are thrown to the lungs, and sometimes there's 10 or 15 or 20 that are thrown over a period of 3 or 4 or 5 days, and you just feel short of breath and just sort of feel uncomfortable. Those there are tests to see how much oxygen is getting from the lungs to the blood system. We can get oxygen saturation, we can get a ventilation perfusion scan, lung scans, but your doctor has to have a high incidence of suspicion, and he will if you come in and tell him what your symptoms are. Pulmonary emboli, the big ones, can be very dangerous. Up to 50% of people will die. The small ones, usually we do a good job, put people on blood thinners. Sometimes we have to put a sieve in the vascular system to keep those blood clots from coming to the lung.
That's all for fibrinolysis for pulmonary embolism patients. Thank you.